afternoon, good evening, wherever you may be. Welcome again to another episode of A Pan-African View. In the episode, we will be looking at the impact of the coronavirus pandemic with a focus on Africa. The coronavirus is an avalanche that has hit us with unparalleled global destruction of lives and world economy. At the time of recording this episode, the number of infections were over 10 million and deaths were more than 500,000 globally. To minimize its spread, governments issued directives which included washing hands with soap, practicing social distancing, wearing face masks at all times, which resulted in a booming local production of very colorful face masks, and avoiding handling cash. If we observed these behaviors in our daily lives, we would all live a healthier and longer life, saving the government billions. In Japan, these conditions are a way of life, and it is no wonder that Japan has the largest number of people living beyond 100 years. These preventive measures should become the new normal, as the World Health Organization has predicted that the virus is not going anywhere soon. In fact, other sources suggest it will become endemic, just like HIV/AIDS, which we have lived with for over 40 years. Then came the lockdowns and quarantines. Police and, in some countries, the army were deployed to ensure we all followed the lockdown directives. We were ordered to stay at home for our own safety and that of others. Those who could afford it installed Wi-Fi and signed up for Netflix, Zoom, and other online platforms, mainly for entertainment, communication, and education. As most businesses declined, telecoms and internet-based businesses flourished. As a result of the lockdown, home services such as the delivery of food and other supplies quickly mushroomed and provided a much-needed service. I have no doubt that this is a service that will remain active post-coronavirus, as it has proved very popular. Schools were closed and students at all levels, including primary level, started studying online. I had to install a Wi-Fi in order for my children to study and had to buy a new computer for my son, who is in primary school. Places of large gatherings such as churches, bars, restaurants, etc. were banned. Weddings and funerals were limited to just the immediate family members. A real challenge for the Africans who believe in huge and extravagant weddings and funerals. I hope that, past coronavirus, these small weddings and funerals will become the new normal. Families that had never sat and had a meal together now found themselves in unfamiliar surroundings. Kids were very happy to see dad at home for lunch and dinner. Fathers attempted to watch TV with the rest of the family, and some were compelled to assist children with the online learning, a huge challenge to the fathers. This newfound family togetherness should be maintained, as it surely must have contributed to great joy and happiness in many families. For the majority who survive on hand to mouth, the lockdown was and continues to be a trying time. Some governments tried to distribute food, but it was not enough. And in most cases, the distribution logistics were terribly bungled. As we will find out later, the fear of lack of money and its consequences, such as hunger, as a result of the lockdown, is what compelled governments to lift the lockdown even as infections were rising. While governments can try to deal with pandemics, No government can survive prolonged hunger in the population. During the pandemic, all sorts of advisors on health matters appeared from nowhere. They told us all we needed to prevent and even cure the coronavirus was to take a drink containing ginger, garlic, and honey. Others said all we needed was vitamin C and D by simply spending some time in the sun. And others said we should just leave the matter to the Almighty. Although Africa has fared better than most other parts of the world, in April, the World Health Organization warned that the epicenter of the coronavirus could shift from its current base, the United States, to Africa. In May, a new study by the World Health Organization Regional Office for Africa estimated up to 190,000 people could die in the first year of the pandemic if containment measures fail. While most African countries have implemented stringent measures to curb the spread of the virus, it will require much more rigorous enforcement of the measures, especially in light of the increasing infections and the imminent second wave. This coronavirus has brought to the fore the good, the bad, and the ugly of social media. Self-appointed prophets, scientists, medical advisors, even G5 experts blossomed. The conspiracy theorists resurfaced and used the social media passionately. Confusion reigned, some of it brought about by incompetent decision-makers from governments. Mr. Bill Gates, despite his contribution of billions to finding cures for various diseases such as HIV, AIDS, malaria, and polio, became the target of the conspiracy theorists. They pointed to Mr. Gates as the man funding research programs that have produced vaccines which have purportedly killed many, especially children in the developing world, and that he is behind a COVID-19 vaccine. Some have gone as far as claiming that he is among powerful people who have an agenda to depopulate the world, with black people as the main target, as a means to controlling the world. Sadly, these conspiracy theorists include some of the top medical and science professionals. According to the theorists, the proposed mass vaccination campaign to eradicate COVID-19 would be the perfect opportunity to introduce a worldwide digital ID by implanting a chip in our bodies. It is claimed that this system would store information about each one of us and would be used to grant or deny access to rights and services. A very frightening scenario, I should say. Would you want the government to have such control over you, or is this already happening? Would this be any different from the current situation where, in many countries, your phone is continuously tracked and monitored, such that the government has access to whatever communication or transaction your phone performs? A well-known American research scientist, Jude Mikovits, believes that the coronavirus was manipulated in a lab and that this is what was released or escaped. The virus didn't jump directly from an animal to humans. She also says the virus manipulation occurred between labs in the United States and the Wuhan Institute of Virology. While many disagree with Mikovits, President Trump and his Secretary of State agree with her that the virus originated in a lab in China. The Chinese have, of course, denied it and instead say it originated in a lab in the United States. The lack of credible information and the barrage of disinformation have elicited confusion and spawned conspiracy theories. Amidst this confusion, numerous conspiracy theories, which are behaving like viruses themselves, spreading just as rapidly online as the virus does offline, have thrived. For example, one theory is that this coronavirus is caused by 5G networks. Fortunately, this conspiracy theory is easy to debunk since the virus has spread rapidly in many countries that do not have 5G networks. What is incredible, though, is how this conspiracy theory has been spread by celebrities with big social media followings, which has led to cell phone towers being set on fire in places like the United Kingdom. Another conspiracy theory, unfortunately promoted by government officials, senior politicians, and media outlets, is that the virus was made in a Chinese laboratory from where it was deliberately released or escaped. There might be some truths in this theory. For one, it is true that the original epicenter of the pandemic, the Chinese city of Wuhan, also hosts a virology institute where researchers have been studying bat coronaviruses for a long time. And it would not be the first time that a virus has escaped. Conspiracy theorists don't believe in coincidences. They claim there is a small group of elites pulling the strings behind the scenes, and that these elites are conspiring against the public. I personally don't believe in conspiracy theorists, as their objectives are unclear, not based on fact, and can only create fear and potential anarchy in populations, and in any case have been around as long as mankind. Most of it is propaganda to suit their agenda and convince themselves they are doing it for the good of mankind. While most of these theories are unconvincing, we should not dismiss them outright but continue to debate them as centers of dark and evil intentions exist. In every crisis, there are people or companies that take advantage of the situation to exploit people, and the coronavirus is no exception. There is no doubt that there are manufacturing companies that intend to unfairly gain from the vaccine once it is discovered. The cure for COVID-19, when found, should be for the common good and not left to the greed of Big Pharma, whose only priority is making huge profits. There is already a growing call, especially among the developing countries, for the vaccine, when it is produced, to be made available to everyone for free. This would be a great gesture, as the impact on the economies of the developing countries will be severe. Will Big Pharma wear a human face this time? I highly doubt. In an open letter signed by several African presidents and another 150 political and civic leaders, they demanded that all vaccine treatments and tests should be patent-free, mass-produced, distributed fairly, and made available to all people in all countries free of charge. Not surprisingly, United States officials close to President Trump rejected the proposal. They argue that such a plan, removing the massive financial incentives for research, would be utopian. Doesn't surprise anyone. The World Health Organization has not been spared. President Trump has suspended the $400 million the United States has been contributing to the organization, accusing the World Health Organization Director General, an African, of trusting China's explanation of the origins of the virus. The World Health Organization's Director General has faced many challenges during the coronavirus pandemic, including racial slurs, death threats, and social media travesties. In reacting to the United States' suspension of its funding to the World Health Organization and attacks from senior officials in the United States government, African ambassadors in Geneva drafted a hard-hitting response to the United States critic and stated, "We note that the Director General is an African, which lends an unfortunate racial undertone to the criticism and related social media campaigns underway. Certain leaders have decided to deflect attention from challenges in managing and mitigating the pandemic to scapegoating the World Health Organization and its Director General. As a Pan-Africanist, I was exceedingly delighted to see the African Union rise to the occasion and with one voice defend the Director General from America's bullying attitude. In most countries, the number of infections continues to rise and there is fear of a second wave. Should this happen, Africa, with inadequate healthcare resources and facilities, such as doctors and nurses, hospital beds, medicines, ventilators, etc., will leave Africa devastated. As an example, statistics show that the number of ICU beds in Uganda is 55, a country with a population of 42 million people. Countries like Mali, Burkina Faso, and Liberia have less than 20 ventilators each. According to the World Health Organization data, across Africa there are only approximately 1.2 hospital beds per 1,000 people. I don't want to imagine the pandemonium that would result if we were to have thousands of new infections per day, as is happening in some parts of the world, including the United States and Brazil. Since it is not possible to improve these statistics in the short term, Africa should continue to intensify the preventive measures already in place and escalate them if necessary. The coronavirus has been the dark clouds before the rain. The onslaught of the economic crisis, a calamity that will be worse than the pandemic, is the rain, and it is already pouring. In February, it was a looming economic crisis, but by April, it was real. The entire world is in the worst recession in history, and not even the best economists know for sure what the immediate future will look like. The IMF predicts that the cumulative loss to global GDP over the period 2021 from the pandemic crisis could be around $9 trillion. Unless you are involved in preparing developed countries' budgets, trying to understand the value of $9 trillion will only give you a headache. To give you an idea, it is greater than the GDP of Japan and Germany combined. The economic effects of the lockdowns across the globe are evident. Many businesses have closed and some of them may never reopen, resulting in losses of thousands of jobs. Restrictions on movement of people, goods, and capital across the world have massively affected the supply chains. Borders have been closed, and this has affected trade among countries. At the time of recording this podcast, 43 African countries had closed their borders, and Tanzania was having border issues with its neighbors, and that with Kenya was quite intense. A situation that is not in the interest of the long-awaited East African Community Cooperation and Integration. Many national revenue authorities are reporting declines in revenue by as much as 50%. The implications will be severe and far-reaching as governments cut spending on development projects and social services. In a survey published by the United Nations Economic Commission for Africa, due to the pandemic and the subsequent lockdowns, about 2,000 residents living under lockdown in 5 slums in Nairobi indicate that the majority could not afford extra soap for hand washing. The survey found that 81% have suffered complete or partial loss of income, and 70% reported having one meal a day. Now, 81% income loss and 70% having one meal a day should scare the hell out of governments and everyone else. Hunger is always accompanied by disorder, anarchy, and civil strife in communities. This is a scenario that must be avoided at any cost by governments, and strategies to avoid such a situation must be implemented now, as the probability of it happening is very real. If the current lockdown measures continue for another 3 months and the economic crisis gets entrenched, we are likely to experience hunger and its consequences. Trade between Africa and its biggest trading partner, China, has been significantly weakened. Countries such as Zambia, South Sudan, Mauritania, and others, who sell 90% of their commodities to China, will be hit hard. Similarly, due to the halt in tourism, mainly from Europe, many North African countries, as well as several West African economies that depend on the European Union for at least 50% of their trade, will be impacted heavily. Many countries will see their GDP growth decline considerably, reducing by as much as 60%. Countries that had projected a GDP growth of 6% will be fortunate to realize 3%, and many may go into negative growth. This will certainly lead to debt defaulting by many developing countries. We hope that the creditors will have the heart to reschedule the debts or just cancel some of them. This will test China's magnanimity, considering the numerous massive Chinese loans Africa holds. Unlike most of the developed countries, many African countries don't have the financial capacity to adopt short-term stimulus measures to support businesses. However, to mitigate the probability of an onslaught of hunger and poverty, mainly from the informal sector due to the loss of income, some countries have set up funds that have been made available to commercial banks to lend to businesses at very reduced interest rates to enable businesses to resume operations and ensure employees keep getting some money for their basic needs. In concluding, a few things regarding the coronavirus pandemic stick out. For example, is there an agenda driven by some powerful people to introduce systems that could control people in order to achieve an ultimate global government? What we all know is that power is all about control, and politicians want it and will do anything to have and maintain it. Church leaders want it, business leaders want it, wives now want to share it equally with their husbands. It is no secret that powerful people have created secret societies that plan and control most of what happens in the world, leaving the rest of us as mere pawns in the game. It is therefore not inconceivable that many power-seeking leaders would want to attain total control over the people by any means. To underscore the potential for abusing power using the pandemic as a pretext, the Kofi Annan Foundation and 28 global leaders have published an open letter in which they state, "Democracy must not become the silent victim of the coronavirus pandemic. The likelihood of upcoming elections being cancelled or postponed in the name of the virus is very real, and some governments are using sweeping executive powers to unjustifiably extend their terms in power." The coronavirus has proved several things. Among them, it has shown us how a little virus can start in one city and in a matter of weeks spread and create mayhem across the entire world. It has shown us how interdependent we are and has exposed weaknesses in the global health systems. It has shown that it is critically vital for global cooperation and coordination, especially when it comes to managing health issues. The world should take the coronavirus pandemic as an opportunity to reassess the way global institutions function and how they are designed to deal with global problems and destructive events. This is an appropriate moment to redefine and reform institutions such as the United Nations and its various organs, the World Bank, IMF, the European Union, the African Union, etc. If the handling of the coronavirus pandemic had been coordinated at the international and regional levels, instead of leaving it to individual countries, the impact would have been curtailed much earlier. The post-coronavirus reforms of these institutions should bring about a new world order. The institutions should be empowered and equipped to tackle the challenges of the coming era. In this new world order, citizens will expect a world order that serves everyone. A new world order in which the benefits of globalization and technological progress are shared more widely. A world order that is more socialist than capitalist. A world order that places priority on human welfare over GDP growth. A new world order that truly cares about and addresses issues like global peace and security, food security, public health, climate change, etc. The pandemic has given an opportunity to the conspiracy theorists, and while most must be taken with a pinch of salt, there are others we cannot simply dismiss at face value. Is there, for example, a scheme by some unknown powerful people to depopulate the world using vaccines? Was the coronavirus made in a laboratory as a biological weapon? Will there be a digital implant whose purpose is to control us? Time will eventually tell. As some countries are lifting the stay-at-home directive, we should be even more vigilant in applying all the precautionary measures which we are now very familiar with. And as the virus will be with us for quite some time, it is time for you to be prudent with your expenditure, as there will be very little or no money around. Soon your long-lost relatives will be knocking on your door. While being frugal, please welcome them. This is the time to show some compassion. As I sign off, let's stay positive and confident that this coronavirus will pass and things will get better. As we say in Swahili, asante na kwaheri. Your host, Gerald Mpisi.